Welcome to our channel where we shed light on important health topics that matter to you. Today, we're delving into a crucial topic: the early signs of colon cancer. Colon cancer is a silent threat, often lurking unnoticed until it's too late, but there are warning signs you shouldn't ignore. Join us as we explore the red flags that could signal trouble and learn why early detection is key to saving lives. Stay tuned to our channel for valuable insights, tips, and expert advice on staying healthy and informed. Let's get started. Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the colon or rectum, which are parts of the digestive system. It typically develops from abnormal growths called polyps that form on the inner lining of the colon or rectum. While most polyps are benign, non-cancerous, some can become cancerous over time, particularly if left untreated. Risk factors for colon cancer include age, risk increases with age, a family history of colorectal cancer or polyps, personal history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, certain genetic conditions, such as Lynch syndrome or familial adenomatous polyposis, a diet high in red meat and processed meats, lack of physical activity, obesity, smoking, heavy alcohol consumption, and certain racial and ethnic backgrounds. Screening tests for colon cancer such as colonoscopy, sigmoidoscopy, fecal occult blood test (FOBT), and stool DNA test (FIT-DNA) can help detect the disease in its early stages when treatment is most effective. If colon cancer is suspected based on symptoms or screening results, further diagnostic tests such as imaging studies like CT scan or MRI, and biopsies may be performed to confirm the diagnosis. Treatment for colon cancer depends on several factors, including the stage of the cancer, its location, and the overall health of the patient. Treatment options may include surgery to remove the cancerous tissue, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. The prognosis for colon cancer varies depending on the stage at diagnosis, with early-stage cancers having a higher chance of successful treatment and long-term survival. Regular screening is crucial for early detection and improving outcomes. Certainly, being aware of potential signs of colon cancer is crucial for early detection and treatment. Here are some early signs of colon cancer that you shouldn't disregard. Changes in bowel habits. One early sign of colon cancer is a change in bowel habits. This can manifest in various ways, including a noticeable and persistent change in bowel movements, such as increased frequency of diarrhea or prolonged periods of constipation, may indicate a problem in the colon. Changes in the consistency of stool, such as stools that are narrower than usual, referred to as pencil-thin stools, ribbon-like or looser in texture, can be an early indicator of colon cancer. Sensation of not completely emptying the bowels after a bowel movement or a feeling of obstruction or blockage in the rectum may signal a potential issue in the colon. Any significant changes in bowel habits, including frequency, urgency, or the sensation of incomplete evacuation, should be evaluated by a healthcare professional, particularly if they persist for more than a few weeks. It's important to note that changes in bowel habits can be caused by various factors, including dietary changes, medication side effects, stress, and gastrointestinal infections. However, if you experience persistent changes in bowel habits, especially if accompanied by other symptoms such as rectal bleeding, abdominal pain, unexplained weight loss, or fatigue, it's essential to consult with a healthcare provider for proper evaluation and diagnosis. Rectal bleeding, also known as hematochezia, is one of the early signs of colon cancer. It occurs when there is bleeding from the rectum or anus, and it may appear as bright red blood on the toilet paper, in the toilet bowl, or mixed with stool. While rectal bleeding can be caused by various factors including hemorrhoids, anal fissures, or gastrointestinal infections, it's essential not to disregard it, especially if it persists or is accompanied by other symptoms. In the context of colon cancer, rectal bleeding can occur due to the presence of tumors or polyps in the colon or rectum. These growths can cause bleeding, either intermittently or continuously, depending on their size and location. Persistent abdominal cramps or pain, especially if it occurs in specific areas of the abdomen or is accompanied by other symptoms, should be evaluated. The pain may vary in intensity and may not always be severe. Feeling of fullness, bloating, or discomfort in the abdominal area may be a sign of colorectal cancer, especially if it persists or worsens over time. Excessive gas, flatulence, or a feeling of increased abdominal pressure may accompany colorectal cancer, particularly if it's associated with other symptoms such as changes in bowel habits or rectal bleeding. While weight loss is not directly related to abdominal discomfort, it can be a sign of advanced colorectal cancer. If abdominal discomfort is accompanied by unexplained weight loss, it should be evaluated promptly. In some cases, colorectal cancer can cause gastrointestinal symptoms such as nausea or vomiting, which may contribute to abdominal discomfort. Unexplained weight loss can be an early sign of colorectal cancer, particularly if it occurs in conjunction with other symptoms or risk factors. Here are some reasons why unexplained weight loss may be associated with colorectal cancer. As colorectal cancer progresses, tumors in the colon or rectum can affect the body's ability to absorb nutrients from food properly. This can lead to unintended weight loss despite maintaining regular eating habits. Cancer cells can alter the body's metabolism, causing increased energy expenditure and calorie consumption by the tumor itself. This metabolic shift may contribute to weight loss, even when calorie intake remains consistent. Some individuals with colorectal cancer may experience changes in appetite, including decreased hunger or early satiety, which can lead to reduced food intake and subsequent weight loss. Colorectal cancer can trigger systemic inflammation and immune responses that affect the body's overall metabolism and energy balance, potentially leading to weight loss. Fatigue and weakness can be symptoms of colorectal cancer, particularly if they are persistent and unexplained by other factors. While fatigue and weakness are common and can be caused by various factors such as stress, lack of sleep, or underlying medical conditions, they may also be early indicators of colorectal cancer, especially if they occur in conjunction with other symptoms or risk factors. Here are some reasons why fatigue and weakness may be associated with colorectal cancer. Colorectal cancer can cause chronic bleeding in the digestive tract, leading to iron deficiency anemia. Anemia occurs when the body doesn't have enough red blood cells to carry oxygen to tissues and organs, resulting in fatigue, weakness, shortness of breath, and pale skin. Cancer cells can alter the body's metabolism and energy balance, leading to increased energy expenditure and fatigue. The body may prioritize resources to support tumor growth, leading to decreased energy levels and overall weakness. Colorectal cancer can affect the body's ability to absorb nutrients from food properly, leading to nutritional deficiencies. Inadequate intake of essential nutrients can contribute to fatigue, weakness, and overall malaise. Colorectal cancer can trigger systemic inflammation and immune responses that affect the body's overall energy levels and well-being. Preventing colon cancer involves adopting healthy lifestyle habits and undergoing regular screening to detect precancerous polyps or early-stage cancer. Here are some strategies to reduce your risk of colon cancer. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins while limiting red and processed meats. Aim for high-fiber foods as they can help promote regular bowel movements and reduce the risk of colon cancer. Engage in regular physical activity, such as walking, jogging, swimming, or cycling, for at least 30 minutes a day. Exercise can help maintain a healthy weight and reduce the risk of colon cancer. Limit alcohol intake, as excessive alcohol consumption has been linked to an increased risk of colon cancer. If you choose to drink, do so in moderation. If you smoke, quit smoking. Smoking has been associated with an increased risk of colon cancer and other types of cancer. Aim for a healthy weight by eating a balanced diet and engaging in regular physical activity. Obesity and excess abdominal fat have been linked to an increased risk of colon cancer. Thank you for watching our video on the early signs of colon cancer. Your health is important, and being aware of potential warning signs can save lives. Remember, recognizing the early signs of colon cancer is crucial for early detection and effective treatment. Stay informed, stay healthy. Stay informed about your health and share this video with your loved ones to spread awareness. Subscribe to our channel for more valuable health tips and information. Together we can make a difference in fighting colon cancer.